Assalamualaikum Warahmatullahi Wabarakatuh. Let me introduce myself. My name is Azizah Riana. Um, Before I reading text, I made these two questions, and my question is: how can one predict whether a person will be addicted to drugs? And two, are there any prevention programs for drug addicts? So, I want to explain about my extensive reading process. My title is Understanding Drug As and Addiction Drug Facts. Okay, what is drug addiction? Addiction is a chronic disease characterized by drug taking and use that is compulsive or difficult to control, despite harmful consequences. But repeat drug use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urges to take drugs. As a person continues to use drugs, the brain adapts by reducing the ability for cells in the reward circuit to respond to it. Long-term use also causes changes in other brain chemical system and circuit as well, affecting functions that include learning, judgment, decision making, stress, memory, and behavior. No one factor can predict if a person will become addicted to drugs. The most risk factor a person has, the greater the chance that taking drugs can lead to addiction. For example, biology, environment, and development. Research from NIDA-funded research have shown that prevention programs involving families, school, communities, and the media are effective for preventing or reducing drug use and addiction. Therefore, education and outreach are key in helping people understand the possible risks of drug use. So, what I know: one, initial drug use is voluntary, but it can lead to changes in the brain. Two, drug addiction can be treated but not necessarily cured. What I want to know: one, factors such as genetic, environment, and early exposure to drugs influence addiction risks. And two, addiction can be treated and managed with a combination of medication and behavioral therapy. So, the answer of question before is: how can I one predict whether a person will be addiction to drugs? The answer is there are no factors that can predict whether a person will be addicted to drugs, because the greater the risk, the greater the chance of using drugs. And two, are there any prevention programs? And two, are there any prevention programs for drug use? The answer is yes. Prevention programs that involve the surrounding community, school, families, and the media can effectively prevent or reduce the impact of addiction. So, the benefit that I can take from readings and understanding the text is that we must avoid drugs because they are very dangerous for health, especially our brains, thus harming ourselves and the future. So, that's all for me. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.